Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today on our show, we're going to be talking about infant sleep safety, and I'm joined by two women who are knowledgeable on this topic. Anna Gabaree is the supervisor of NMC's Family Birthing Center, and Rhonda Desroches is the nurse manager of maternal child health at Franklin County Home Health Agency. So thank you both for being here. So I was wondering about this topic, but I guess it is a pretty important topic for us to be thinking about. But first, can you tell us a little bit about yourselves, maybe how long you've been a nurse and kind of what you do?
Absolutely. So I've been a nurse for 11 years now, and I've been lucky to work on the Family Birth Center at Northwestern Medical Center for the whole time. Recently, about a year ago, I transitioned into the supervisor role of the Family Birth Center, and it's been very exciting.
Yeah. That's good for you. Great. And Rhonda, what about you?
Well, I have been a nurse for 23 years, and all of that time has been spent working in pediatrics or maternal child health. The last 13 or 14 years I've been working in home health, 10 years as a home health visitor for maternal child health, and then the last 3 years as a manager, a clinical manager for nursing and maternal child health.
See, that's what happens to great nurses. They go into supervisor and manager positions, right? So, again, thank you for being here. So why should we be talking about infant sleep safety?
Well, that's a really important question, Jill. Over the past few years, there's families in our area that have had to experience the death of a child that's been directly related to the sleep environment.
Oh.
Yeah, it's really important for parents, families, and the community to be aware of the recommendations or the evidence-based recommendations around how to provide a safe sleep area for a child, for a baby in the community.
So in thinking about this, so we get it right out there at the beginning, are there tips, or you mentioned best practice, are there some tips that you could offer to the community?
Well, we'd like to start off by saying that Northwestern Medical Center has been working with Franklin County Home Health Agency, with the Department of Health, Northwestern Counseling Support Services, and Building Bright Futures. Those are just a few community partners that have been working together to address the issue. And we are very committed. We're really proud of our partnership coming together, and we're working hard and really committed to raising the awareness around safe sleep in the community so that we can keep our babies safe.
Terrific. Terrific.
And we came in today to discuss the American Academy of Pediatrics recommendations and tips for safe sleep, which we graciously got from the Department of Health prior to this meeting today. So first of all, we just want to stress that these are the tips for the general public, but if there's any health conditions that may require different safe sleep spaces, please talk to your pediatrician prior to following all of the tips if your child has some concerns with health conditions. But the very first tip is that every child for every single sleep needs to be in one of these safe sleep positions and spaces. It's not uncommon for us to hear daycare providers say, you know, I put the baby on its belly for a nap, I'm awake, I'm right around, but it only takes 3 minutes for a little one to pass away. Really, every sleep, every time needs to follow the following tips. So the next tip really is that the baby needs to be in an approved sleep space with a tight-fitting mattress. And then tip number 4, I'm going to skip around a little bit, is related to the tight-fitting sheets on the crib. You don't want any loose blankets. You don't want any bumper pads. You know, there's beautiful things out that is marketed in the community.
Yes.
Grandmas make beautiful quilts for babies, and those are all extremely dangerous for little ones. Studies have shown that they reduce the airflow through the crib and can increase the risk of SIDS and also increase the risk of death by suffocation in the bed for the baby. Sort of along the same lines, tip number 3 is related to sleeping in bed with your baby, and even falling asleep with the baby chest to chest with you in a recliner or on the couch have even proven to be more dangerous than sleeping in bed with the baby. So all of those things really are not recommended. They feel so good, but they can be extremely dangerous. And then studies have shown, and I was actually surprised by this one, that smoking during your pregnancy can increase the risk of sudden infant death syndrome after the baby's born. So smoking in general, through pregnancy and after pregnancy, whether it's in the car, a well-ventilated area, just secondhand smoke in general is really dangerous for little ones and can increase their risk for a sudden infant death. And then there's drugs and alcohol, which can inhibit, impair you and impair your ability to make safe sleep decisions for little ones. And then I'll have Rhonda talk about the next few tips.
Wow.
Yeah, so another tip would be after breastfeeding's established, it's okay to go ahead and start using a pacifier. The use of a pacifier to calm the baby, to get the baby to sleep is actually, there's some evidence that supports that's actually a way to decrease the risk of SIDS. So it's okay to start using a pacifier.
Okay.
And I think lots of parents will be happy about that. And then, thinking about the way that we dress our babies to go to bed, parents don't want to be bundling the baby up in a lot of blankets or putting a lot of clothes on the baby, increasing the temperature of the room. A good rule of thumb is if the room should be warm enough where I'm comfortable plus one layer. So,
Okay.
and loose clothing like bibs or scarves, hats on the baby during sleep time should be avoided because those can become loose and either suffocate the baby or actually strangle the baby with like the bib. A good idea would be to put the baby in a footed pajama with a light blanket such as a receiving blanket. You'd want to tuck it into the foot of the bed and on the sides of the crib mattress, and the blanket should be no higher up than the armpit of the baby.
Okay.
And then another thing I see actually as a home health nurse, I go into homes and I see well-meaning parents who are just trying to keep their babies safe. They've gone to the store and they've bought devices that claim to reduce the risk of SIDS, such as a wedge or a positioner, a safe sleep surface. These are all things that you can find in the store that claim that they reduce the incidence of SIDS, but actually there's little or no evidence that supports the safety of those items, and they're actually probably pretty unsafe, especially if they're used incorrectly. So I would definitely encourage, and the American Academy of Pediatrics really recommends not to use those. And then just letting the people around you, your family members, other care providers like daycare providers, know what the recommendations are. They may not know how to provide a safe sleep area for a baby. So we want to be educating those around us. And it's actually parents have the right to expect and even demand, that family members and other caretakers provide a safe sleep area for their babies. And those are, I think we've covered all 10 tips.
Wow. I don't know, that makes me a little bit nervous about
It does.
making sure we get it just right. So if you were
Yes.
to visualize a child, in their crib, so would they be lying on their back, no hat? Could you describe what you would see as applying those tips? What's the perfect position?
Well, I would
Summarizing
say,
those.
so do you want, I
Sure.
can talk about it, or? Well,
Go
we
ahead.
want to see a regulation crib, one that has a tight-fitting mattress that you can't fit 2 fingers in between the mattress and the side of the crib.
Okay.
The slats would be regulation, which is 2 3/8 inches apart, because a lot of times babies can get in between those slats. And as the baby's sleeping, the baby will be on his or her back in a comfortable outfit, depending on what time of the year it is and
Not
what the
loose
temperature
fitting.
is. No loose fitting clothes, just perfectly
I
right.
was listening.
And if needed, just a light cover over the baby. But oftentimes, really, the sleepers that are sold, can often be very thick enough to you wouldn't have to have a blanket. But the baby, you want the baby in the crib, maybe even a little bit lower in the crib, not dead center, but a little bit lower in the crib.
Okay.
So on their back.
Okay.
Nothing in the crib. There's nothing in
no
I
toys.
see nothing in the crib.
Okay, good.
I
That's
see
what I
a
wanted to hear.
sheet,
There was
a
no
sheet
toys.
and a baby and a blanket, maybe.
Okay, no puppies
very
or
thin
anything
blanket.
like that.
No siblings.
Yeah, okay,
So.
good. I don't mean to make light of a very important topic,
Yes.
but just to, I know everybody wants to get it right for their
Yes.
baby, and so I
Yes.
thought that visual would, at least
Yeah.
for me, would.
Well, that's a good
help.
point too, though, because we do see all of that when we go out into the home. There, oh, it's just a little.
And in the hospital.
Yes. Oh, it just, grandma bought the little teddy bear and we're just going to put it over in the corner. It'll be fine.
Okay.
Really, it's not.
Okay. So what's the difference? Maybe talk a little bit about the hospital setting and then the home setting, maybe your educational differences there. And
Sure. So basically in the hospital, we've implemented some really great new evidence-based guidelines related to skin and rooming in. But moms can get really tired, and then if you add pain medications on top of that, and it's your body's gone through so many changes and the hormone releases that happen when you're breastfeeding your baby, it's really, really easy to fall asleep with your baby in bed. So we really recommend, if you're getting tired, to speak up to your support person and ask for help. And along those lines, we really recommend you have somebody spend the night with you, somebody that you trust, somebody that you know will step up and help you when you're exhausted. It's, although skin to skin is recommended and rooming in is recommended, it's really important not to fall asleep with your baby in bed with you. Luckily, we haven't seen any death by suffocation at Northwestern Medical Center, but what we have seen, and the reason why we wanted to do this today to raise awareness, is we've seen moms fall asleep with their babies and fall out of bed and crack their little head on the floor, which can be really traumatic, and it's really not good. So we really need to raise the community awareness in our area about sleeping with little ones. And like I mentioned, to help with that, we recommend having a support person with you. Speak up to your nurses. We can come help rock the baby for you if you're just really tired, or we can bring the baby for a walk for you so you can fall asleep, and then we can get little one asleep in the safe sleep space and return the baby to you once they've fallen asleep. And we have these recommendations in the hospital, and I would just like to bring up that they're also the recommendations for when you go home. To have the baby, studies have shown having the baby in your room with you also reduces the risk of SIDS, but they need to be in their own safe sleep space at home as well as in the hospital. And that's really what we teach in the hospital as well.
Thank you. What about in the home setting? And I know there's cribs for kids?
Yes.
All right, let's hear more about that.
It's a great program. Well, so every year in the United States, there's about 3,500 to 4,000 infant deaths that are attributed to sudden infant death syndrome. But further investigation has shown that many of those deaths have actually been the result of an unsafe sleep environment. So Cribs for Kids is a safe sleep initiative that's been helping to impact the number of those infant deaths from SIDS since 1998. Last year, Franklin Grand Isle Building Bright Futures Council partnered up with Cribs for Kids so that we could provide safe sleep survival kits to local families who qualify. Free of charge, of course. It's free of charge for them.
Excellent. Nice to know.
It is. It's a great program. So the kit has a pack and play, which is really great. It has a sheet that goes in the pack and play, well-fitting sheet. There is a sleep outfit for the baby, a CD that talks about safe sleep, a book that talks about safe sleep, and just other educational materials. A nurse from Franklin County Home Health Agency actually goes out and delivers the Safe Sleep Survival Kit to the family, and then provides that education around safe sleep at the same time. Yeah.
That's excellent. Wow, I didn't realize, obviously it's important, but there's so much to talk about. And I can only imagine folks that are going to hear this talk are going to go, first gasp, because they've probably been doing all of those things, but then relieved to know really, what the right thing is to do.
Yes.
So Anna and Rhonda, our time has flown, but thank you so much for being guests. And this is such valuable information. I really appreciate you taking the time to do this.
Thank you for
so
having
necessary.
us.
This is Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you so much for joining this session, and how important for infants to be in a safe sleep setting. So practice that. It's important. Thank you.